Today I'm going to tell you a story. More than 500 years ago, there was a man who visualized how technology could change the world. Learning never disrupts the mind is one of his famous quotes. Then he set about to totally disrupt the world, and did just that. He conceptualized flying machines, a type of fighting armored vehicle, concentrated solar power, an adding machine, the double hull, and also outlining a rudimentary theory of tectonic plates. But this man was not a geek or a nerd by today's terms. He was an artist, a student of philosophy, physiology, and the humanities. He knew that science without an understanding of human nature was simply play with no useful purpose or meaning. But this man was also the one who built the first robot that had anatomical proportions and followed the established Vitruvian canon. Also had three-dimensional details. He basically made an android that had the external appearance of an armor. We can see it right here. And also, it is important to notice that it was the first robot that could move by himself his own head, arms, and hands. The greatest of all, Leonardo da Vinci, who is honored by the surgical robot that is right here, developed by the North American company Intuitive Surgical and approved in the 2000 by the FDA, the Food and Drug Administration of the United States. What if I told you that Da Vinci's robot can decrease the post-operative complications in a higher quantity than 80%? It might sound a bit difficult, but in the last 10 years there have been great advances and innovations in medical care and technology. For example, through gene editing, the gene that causes a person to have a disease can be eliminated. Until now, this was just a theory, but in 2017, the Spanish scientist Francisco Mojica showed up that it can be applied in reality. Another example are insulin pumps and patches. One of the most complications of the diabetics are the constant need to insert insulin through injections. But also in 2017, both insulin pumps and patches were created to eliminate the need of worrying about needles. And in the surgery field, we have examples such as the virtual liver surgery. Centers as the Academical Hospital Elena Infanta of Valdemoro in Madrid use a technique based on three-dimensional printing, managing to operate on the most complex liver tumors before entering the operating room. It does it in a virtual way so that it can carry out previous simulations and establish personalized surgical strategies for each patient, optimizing the results. And the last example is remote interventions with the help of robots and high-speed communication networks. Imagine a surgeon who has his headquarters in Colombia, but he operates on a patient who is in Bolivia, 2,601 kilometers away. I mean, that's a huge distance. 2,601 kilometers away, it's like going from Caracas to La Guaira 87 times in only one day. Robotic surgery makes up for the limitations of conventional laparoscopic surgery, making surgical procedures more comfortable and more accurate, especially the most complex and difficult of access procedures. But how does the robot achieve this? Well, let me explain to you how it is made up. The system has three elements: the console for the surgeon, the cart with the light source, camera, and insufflation equipment, and the tower that supports the robot's arms, which can be 3 or 4 depending on the model. The surgeon operates comfortably seated in ergonomic position at the console, manipulating the robot arm and obtaining a three-dimensional view of the patient's interior through a binocular viewer of the images that are captured by the camera system placed in the patient through a 10 or 12 millimeters portal standout. In this console, it is also possible to simultaneously view the imaging tests that were performed before the surgery, or the biopsies that were positive within the prostate, kidney, colon, or rectum. Also, this system allows the use of a fluorescent system that helps the surgeon to locate the blood vessels of the area, reducing the bleeding during intervention. The comfort of the surgeon during the intervention avoids the fatigue that affects many surgeons who operate standing up in long and complex procedures. This console, it is also connected to a powerful computer that is like the brain of the robot, which projects on a screen everything what the surgeon is doing and seeing, and also allows assistants to interact with the surgeon during the intervention, drawing or pointing on the screen and manifesting their point of view and discuss it with the surgeon.
Once the patient is anesthetized and the access ports have been placed through the skin, the robot is attached to these ports and the surgical instruments are inserted. These obey the surgeon's hands and give him great freedom of movement in all directions or angles, improving its quality, reducing tremor and increasing precision. The surgeon visualizes the patient's interior in 3 dimensions, as if he were inside, thanks to a high-definition stereoscopic visualization system that allows the image to be enlarged in order to visualize the microscopic anatomy when it's necessary. This makes the surgeon experience a sense of immersion in the surgical procedure and comes to identify with the robot and feel that their ability to operate has been increased.
Dr. Elias Bowling, who is an urological surgeon at the National Hospital of Panama, once had to operate in 2018 on a patient that had been undergoing annual prostate checkups for 7 years and always had normal results. But suddenly, after a year, he was diagnosed with a prostate cancer with micrometastasis. So they both decide together, the doctor and the patient, to operate the patient with Da Vinci's robot. Through prostatectomy, they managed to remove the tumor and increase the patient's life expectancy. After the surgery, the doctor explained to us the advantages of laparoscopic surgery with the aid of the robot compared to conventional surgery. So, which are these developments? Well, first of all, we have that there's no pain after the surgery. Then that the wounds heal quicker. We have to remember that the wounds of conventional surgery can take weeks to heal. Third, there's no subsequent skin infection after the surgery because the incisions made are very small. The bleeding during the surgery is considerably reduced. The time of the surgery is faster. Also, we have visibility of the microanatomy, allows tumors to be removed with greater precision. Also, we have during the intervention, direct access to the required organ is achieved, and last but not less important, in prostate surgeries, it allows the patient to have a faster recovery of sexual function and also to increase the possibility of maintaining urinary continence. The excellent results of the robot, which are clear as water, have led to hundreds of surgeries being performed around the world in multiple countries every day using the Da Vinci's robot, making it not only useful for urological surgeries but also useful for gynecology, otorhinolaryngology, abdominal surgeries, and also cardiothoracic surgery. The doctors can assure that minimally invasive laparoscopic surgery performed or supplemented with the Da Vinci's robot is precise, safe, and exact, with excellent results in the patients in which it has been used, both in our national experience at the Clinical Caracas Hospital, as well as published international papers reports. Its use is currently limited by the high cost of the equipment and its maintenance. Learning to use it is relatively quick and facilitates surgical intervention for surgeons with experience in conventional laparoscopic surgery. So, its use and application in general surgery and other specialties is completely recommended.